Notifying someone that a death has occurred is not an easy or pleasant process. It's something that intimidates a lot of EMS providers, but it's a part of what we do, and it's something we need to be good at. The traditional view of death notifications is that this is something law enforcement does. You picture someone knocking on the door at 3 o'clock in the morning and letting a parent know that their child isn't coming home again, or some other similar circumstance. In those settings, law enforcement officers have some time to prepare, an opportunity to think about what they're going to say, how they're going to deliver the message, that sort of thing. Well, we don't always have those resources, and a lot of times in emergency services incidents, we don't even have law enforcement who may be experienced in this role available to take on that job. If you have a chaplain, that's a phenomenal resource. A lot of departments have them. They may or may not be available at the time you need them, but they're trained and have experience in dealing with these difficult situations. In some systems, they have specially trained teams who have extensive training in how to work through this process. But in most of our EMS systems, and especially on emergency scenes where we don't have a lot of lead time, we don't know what's coming, the responsibility falls to whoever's there facing the survivors. And if you're there, and if you're willing to do the job, it's yours. And this is challenging, but I will also tell you, I think it's an opportunity. I think it's one of those opportunities where we can make a significant difference, and we need to not be one of those people that ducks and runs for the rig when this need arises. We need to be ready to step up and make a difference. So we're going to talk a little bit about what's involved, which basically is recognizing or pronouncing a death, deciding that you're going to terminate resuscitative efforts or recognizing that there's no reason to initiate them. Identifying who the survivors are, so you need to make sure you're communicating with people who are friends, family, and know what their relationship is. You need to deliver the message, and a lot of times this is the hardest part, is figuring out how you're going to say it and what you're going to say. You need to display support and compassion. You need to be there to support people in one of the most tragic and difficult times of their life. And there's logistical things like dealing with the body and what are the next steps, what's going to happen next in this process. And I'm going to talk a little bit about us taking care of ourselves, because this is one of those difficult things that we deal with in EMS. So the question comes down in these scenarios of who is really your patient. We are in the business of making a difference. Just about everyone I talk to in EMS says they got into EMS because they want to do something meaningful. They want to do something that makes a difference in people's lives. And when we know our patient is dead or our patient is not going to survive, then the survivors become the ones who really need and deserve our care. The survivors now become the people who are an opportunity for us to provide service. And I would argue that this is one of the biggest opportunities you will have as an EMS provider to truly make an impactful difference in someone's life in the midst of something that may be one of the most difficult things they've ever dealt with. So we'll talk a little bit about why it's important. Tim Dietz is a firefighter paramedic who is retired now and is a professional counselor specializing in grief and loss and first responder stress. He's actually a national and international speaker these days. And he talks about the impact that happens during the immediate crisis and that permanent imprinting of those memories for the rest of the survivor's life. And he has some experience with this. He lost his son, who was a toddler at the time, in an accident, and his own fire department responded to the scene to find his son, who had drowned in a bathtub in the care of a babysitter. So he's been through some loss, knew what it was like dealing with the responders and the hospitals and that process. And I've learned a ton of information about him, from him, about how these experiences can impact the survivors on scene and the people that we deal with. Jeffrey Mitchell is an expert on crisis management and crisis intervention in EMS and emergency services in general. And he's quoted as saying that assistance provided by public safety personnel is often more significant in terms of the overall crisis than much of the help which is provided by hospital staff and counselors. And I think that's really important to remember. And what he's saying is that after the fact, down the road, these folks are going to have contact with a hospital. They're going to have opportunity to meet with counselors. They're going to have a lot of opportunities to deal with this trauma in various ways. But we have an opportunity to impact them in the immediate setting when they're reeling from this impact. And that immediate intervention is absolutely impactful on what happens. And I will kind of outline for you that it's not as difficult as we perceive that it's going to be. You're not being asked to be a counselor. You're being asked to be a compassionate human being in this difficult situation. So some of the reasons why we struggle with this is, number one, it's not our job. But like I said at the start, that's not really true. In most EMS systems, you are going to find out that it is your job, that you are in the position where you or someone on your team needs to make the notification, needs to have that conversation with the family member, and that's just what we do. Another common phrase that's heard is, I don't know how to do this, or I was never trained for this. Well, hopefully this very short video is a nice start to that, of giving you some ideas and some tools for how to feel more confident with it. We don't know what to say or what not to say, and I'll talk about that, but again, it's simpler than we make it. And we have our own struggles or questions about death and loss. If you are reeling from a loss in your own personal life, or have some unanswered questions in your own mind about loss and about death and how that all works, you may not be the best person on your team to be helping someone else through a death or a loss. And another factor is that most of us in this society, are uncomfortable facing people in grief. In Western society, unlike some cultures, grief is a private process for the most part. Grief is not something we do in public, and because it's not so publicly acted out, we don't encounter it a lot. And so for most of us, we haven't dealt with a lot of grief in our life. We haven't dealt with a lot of people who are going through grieving processes. And just like everything else, it's difficult to deal with things that you're not familiar with. So how do we get good at this? I would say it's like everything else we do. We prepare for it, we jump in, and we do it to the best of our ability. And the more we do it, the better we get at it. The bad news in that is that to be really good at this means you have to deal with a lot of death and a lot of loss. And the reality is, if you do EMS for a long career, you are going to deal with a lot of death and a lot of loss. That's just part of the package deal that we sign on for when we decide to become emergency providers. But if we don't shy away from these opportunities, but we embrace it as an opportunity to provide a much needed service, it does get easier, we get better at it, and our patients, the survivors, the people we encounter are going to benefit because of it. And we need to keep ourselves healthy. That's mentally and psychologically healthy, so that we're ready and that we can be effective when we're needed. It's important to remember that grief takes many forms. And you need to recognize there's no one correct or appropriate way for people to respond to death, to respond to loss. Unexpected death may be especially difficult for people to deal with, but even a known and expected death can be very traumatic and very difficult. And we have a hard time, again, facing grief, seeing grief. Some people in grief yell and scream and wail and carry on in very dramatic emotional ways. Other people become very stoic and quiet and hold everything in. There's not a right or wrong way. You just have to recognize that it comes in different forms, and we have to be very careful that we're not judging people's response or making assumptions about what it means, because it's such an individualized process. We also have to think about the fact that death comes in many forms, and that might change the way notifications are made, the way you deliver these messages and the circumstances. One example is chronic and terminal illnesses. In some ways, this is easier in that people, family, others, knew it was coming. They have some time to prepare for it, some time to put things in order, but it's not always easier. And even when it is a known and expected event, terminal illnesses can be an ugly, unpleasant experience in the final stages, and oftentimes either the patient or the family or both are really not real well equipped to respond to it. And so we end up in the middle of those situations, and we have to navigate those carefully. Trauma has its own challenges. In traumatic and violent death, we often see gruesome injuries, visually disturbing things that are going to be harder for a family member to witness or to see. Trauma tends to be also unexpected and sudden, and has psychological trauma that comes with it because of that. Crime scenes are another violent and traumatic incident or circumstance where it becomes tricky. I'll talk in a minute about allowing people to be with the body, having time with the deceased. And that could be difficult or impossible in some crime scene situations, and you have to work with law enforcement to figure out the right or appropriate way to manage those issues. And unexpected cardiac arrest. This is one that is one of those circumstances that we see more and more where we are in the position to decide whether or not to start resuscitation, or if resuscitation has been started, making that decision to terminate our resuscitative efforts. And that can be a challenge all in its own. So up until about 15 years ago, the standard approach in hospitals was that family was put in a waiting room and not allowed to witness any part of the resuscitative effort. In 2005, the American Heart Association came out with a statement that family members should be allowed to be present during resuscitation. Well, this was not new or different for EMS. They've always been present because we're doing a resuscitation in their kitchen or in their living room. They're going to be present. And what a lot of us have known for a long time is that is not detrimental to the resuscitation, and it's not detrimental to the patient's perception of what happened. When they see our efforts, even if they're not perfect, even if they're not flawless, when they see us working hard and trying hard to resuscitate their loved one, doing it to the best of our ability, people are very supportive and very accepting of the fact that efforts have been made. If they're blocked from it, if they didn't see it, if they don't know what happened, they're left questioning and wondering whether or not the right things were done. This is an awesome opportunity to keep the family or the loved ones informed about what we're doing. That will help them understand. It'll also prepare them for what's coming next, especially if what's coming next is that we're going to make a decision to stop the resuscitation effort. So in a resuscitation attempt, we need to be careful about how we share information. We should avoid complex terms and medical terminology. We need to explain what's going on, and we need to explain it in ways that patients can, or that family members rather, can understand. We need to explain the patient's response or the lack of response. So for example, we may be telling the family member, your son is not breathing right now, so my partner is breathing for him. We're going to put a tube down his throat in order to take over his breathing, and then we're going to take him to the hospital. Or your wife's heart is not beating on its own. That's why we're doing CPR. Unfortunately, she's not yet responding to our treatment. We're going to try a medication to see if it will restart her heart, but right now she's not responding to our treatments. That sort of explanation sets the person up to start beginning to realize what's going on and what's the logical next step or what might likely come. In that process of explaining what you're doing, you also have an opportunity to evaluate whether or not they understand it, whether or not they accept it, which can help you to figure out sort of how to communicate with them in the next steps. Once we've determined that this is a death notification, once we've determined that we're no longer resuscitating a viable patient and we need to step into this role of delivering the message, we need to switch gears. We need to stop being the rescuer and be the notifier. At that point, I would strongly encourage you to physically change gears. Take off your gloves, wipe the sweat off your face, take a deep breath or several deep breaths, practice some tactical breathing, and soften yourself. Soften your personal approach and demeanor so you switch out of that clinical focus that's all about treatments and drugs and dosages and resuscitation, which is what we appropriately focus on in a resuscitation, and change gears to focus on empathy, focus on being a compassionate human being to the people that need that right now. Getting at their eye level makes sense, making eye contact is good, and communicating clearly and directly. That doesn't mean being blunt, but it means being clear about what has happened, and allow them time to process the message. Simple messages like, we have tried to restart her heart and we were not successful. We've tried medications and she didn't respond. At this point, her heart has not responded to anything that we've attempted, and I'm sorry, but your mother is dead. It needs to be that direct. It needs to be that direct without being uncaring or overly blunt. Let them process one piece of information before you say more. And the reason we do that is because in the midst of psychological trauma, our brains, similar to any other sympathetic nervous system response, are not capable of complex processing. And we need to give people time to process it, time to understand it before we say more. As I said, use clear terms. Vague terms like passed on, no longer with us, aren't really helpful in these circumstances. Died or dead are clear terms that people can relate to. And it doesn't have to be uncaring when you use those direct terms. And if you made resuscitative efforts, kind of like I just described, explain those. Or if you didn't, explain that. Explain that when we got to your friend, his injuries were incompatible with life. No matter what we would have done, he was not going to survive this accident. Be direct, be clear, make sure that people know what you did, what you didn't do, and why. So things that we shouldn't say, and this is one of those things that people worry about, understandably. You don't want to say the wrong thing. And these are, the list that I'm about to show you, are examples that came from interviews with survivors talking about the messages that they got from people who were notifying them. I know how you feel. No, you don't. There's absolutely no way you can know how another human being feels. You may appreciate it, you may empathize with it, you may have been in a similar circumstance, but you don't know what they're feeling. You don't know what their relationship was. You don't know what argument they had that morning that set a completely different tone on the last conversation they had. There's so much we don't know that we don't know how they feel. I understand. Again, maybe, maybe not, probably not. You shouldn't feel that way. This is one of those classic things. You never negate someone else's feelings when they're in grief or when they're struggling. You are so strong. If someone seems to be handling this really well, again, people grieve differently, and that's not necessarily a sign of anything positive. If you had only done whatever, obviously a horrible thing to say. Your anguish won't bring them back is just silly. They led a good life. Well, that may be true, and that's a great thing to talk about at the funeral in a few days. But it's too soon to have that conversation now. It was God's will. Again, these are things that were actually said by people, and it would have been worse if. Well, really not helpful at the point that someone is trying to think about what just happened and reeling from the grief for you to try to picture a worst case scenario that would have been even worse than this. So the question is, why do people say these things? These seem to be really insensitive, inappropriate comments. Are these just insensitive, cold-hearted people? Of course they're not. People say these things because they don't know what to say. And they feel this overwhelming need to say something. They want to say something and they don't know what to say, so they try to say something that they think in the moment will be a good thing or be reassuring. What should we say? It's really, really simple. I'm sorry. This does not imply that you have done anything wrong. In our society, this is widely accepted as a simple expression of empathy and concern. Or, I'm so sorry for your loss. Even more removes it from you apologizing for something. I am sorry for your loss. That is a safe, reasonable, supportive thing to say. A couple other things you can say. Is there anything I can do for you right now? And is there somebody I can call? That's it. That is the whole list. In my humble opinion, after 35 years of EMS, I can tell you that these statements, I'm sorry, is there anything I can do for you, and is there somebody I can call, are not going to cause a problem. They are not going to be misperceived. They are not going to get you into trouble, and they're going to clearly express that you care and that you're there in a supportive role. Oftentimes, you don't need to say anything. You just need to be there, and showing that you care is very powerful. Sometimes I've been in circumstances where I've said, is there anything I can do for you right now? And they said, I don't know what that would be. And I've said, is there anybody I can call? And I'm thinking of one case where the woman looked at me and she said, I don't have anybody left. And I said, is it okay if I just sit here with you for a while? And I sat on her couch for about 30 minutes. And we didn't talk, we just sat. But she wasn't alone while she waited for the next steps. And that was what she needed. And that's powerful. You will feel the impact you have on people by slowing down and taking a moment to be there. Maya Angelou says that people may not remember what you did, but they will remember how you made them feel. And as Tim Dietz said about these kind of death situations of a loved one, they may also remember the details of what you did, but they will absolutely remember deeply how you made them feel. And that's what we're really trying to get in touch with. Another thing I want to mention on is the power of touch. Appropriate touching is powerful. It absolutely connects us to other human beings in ways that very few other things can. And the safest and most appropriate touch when you're just trying to express empathy is placing a hand on the shoulder. In almost every culture, in almost every religious system, this is by far the safest approach that's the least likely to offend anybody. But when you put your hand on someone's shoulder, when you hold someone's hand, when you touch in a way to try to reassure, you need to be very perceptive to how that's received. And if they don't like it, if they pull away, if they seem uncomfortable, then obviously you're going to stop doing that. But most people are going to respond well to a gentle touch. Faith, beliefs, prayer, these come to light in a powerful way at the end of life. So the question comes up, is it okay to pray with or pray for your survivors? This, in my opinion, is not something we as providers should initiate. But if as a survivor, if the person you're dealing with asks you to pray with them, and that's something you are comfortable with, that's consistent with your faith system, then by all means. What we have to be careful of is doing anything that's not true, that's not genuine, that's not sincere. So follow their lead. Be genuine, sort of like the touching. It's okay to touch someone. Is it okay to hug them? Well, you certainly shouldn't initiate the hugging, but if they turn and throw their arms around you because that's what they need, and you're comfortable returning that as a show of compassion and empathy, there's nothing wrong with that. We just have to make sure that our interaction fits the situation. Another thing that Tim Dietz talks about is seeing the body, being with the body. And this quote is important, that people who are allowed to spend time with their loved one at the time of death do better in the long run. And we tend to think, if you're not ever involved in these situations, that nobody wants to see their loved one who's been traumatized, seen them with gruesome injuries, see them in that death state. They'd rather remember them when they were alive. And the reality is, seeing the body, being with the person, holding their hand, those things, that closure, that ability to recognize that this has really happened is powerful, and it's important. And we need to give the survivors the choice of whether or not they want to do that. If you have someone who has injuries, if you have someone who is not going to be pleasant to look at, you need to tell the survivors truthfully about it and ask if they want to be with them. Warn them of what they're going to see. Think about covering up the patient, or maybe the entire patient, with a blanket. Tim describes a case where he had someone who was horrifically injured and a family member on scene. The parent was on scene. It was a teenage boy that died in the accident. And Tim covered up the entire body except for his right arm that was sticking out from under the blanket because it wasn't mangled. And he explained to the family that they would not want to see the damage that had happened, but they came and sat with the body and held the hand. And they spent their time, they had that opportunity, and that satisfied that need for them, even though they didn't have to see the gruesome things that probably would have been better for them not to have to see. Oftentimes, people who are allowed to see a horribly injured person walk away with a comment of, well, that's not as bad as I thought it was going to be. If possible, it's nice to make the body look comfortable. So if we can put a blanket over, move the arms so they're in a natural position, make them look like they're not in pain, that actually has a significant impact on the survivor's memories of that encounter and what their thought process is around that death. If you do have to if you find yourself in a situation where you're allowing someone to see the body, someone needs to stay with them until support can be obtained. Again, if you have chaplains in your system, they're a great resource to come in and take over in these settings and work through these stages. They need to let people grieve. They may be screaming, they may be crying, they may be sobbing, they may need to just sit quietly and not make a sound for 30 minutes. You got to let them work through the process and provide support that you can. What can I do for you? Maybe there's something you can do. Most of the time there's not, but be supportive. Some good resources if you want to learn more than this 30-minute video. Scenes of Compassion by Tim Dietz is an excellent book. It's a small little paperback that is a very easy read that just goes over in detail the things that I'm talking about. The Emergency Response to Crisis, Jeffrey Mitchell is a guru on critical incident stress, not just to critical incidents, but managing stress overall. And we need to take care of ourselves. We routinely deal with things that nobody should ever have to see. And that's the nature of emergency services. So you need to keep yourself prepared. You need to eat well and exercise regularly. You need to train so you are good at what you do. Let me say that again. You need to be good at your job. If you're cutting off the training, you're not really keeping up on your skills. If you're not competent and confident in your skills, there's more chance for you to question your ability, question the appropriateness of your interventions, be uncertain and stressed yourself, which does not help in dealing with these stressful situations. So you need to be good at what you do and stay good at what you do. Develop close friendships on and off the job. Talk when you need to, when you're feeling something, find someone you can talk to and talk about all of this stuff. And listen, when your coworkers, when the other people around you need to talk, that's the time to listen. And make time for things you love to do. EMS folks tend to get completely immersed in EMS. They work full time, they volunteer on the side, everything they do in their lives is wrapped up in EMS. Make sure that you make time for family, for friends, for hobbies and outside activities that have nothing to do with EMS, and laugh. Anything you can do to increase the amount of laughter in your life is going to help keep you sane and help to keep you happy and effective. And make sure that you have a system for managing stress, not just the critical incidents and the debriefings that go with those, which are a phenomenal tool, but also the ongoing chronic stress management that we deal with in EMS. You need to take care of each other. I absolutely believe that we have the best job in the world, and we work with amazing people who've dedicated themselves to this. We need to look out for one another in order to keep all of us strong and healthy. And we need to not be afraid of death notification situations. We need to not be afraid to step up, because these are opportunities where you will make a significant impact, where you will make a difference in another person's life.